Hi, my name is Dr. Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. On today's episode of Face the Facts, we surveyed the audience to see what they were interested in, and so we're going to pick a topic that someone asked us to discuss. But first, I just want to throw it out there. I cannot believe that, yay, we've somehow hit over 50 episodes, which is so crazy to me because I feel like time has just completely flown by. We're going to just keep going until somehow we've covered every single topic there is. So that being said, today's topic is going to be, how do I plan for a rhinoplasty or a nose job? So my process is, generally, once you have decided that you are going to come in and see us, my patient care coordinator will reach out to you on the phone and talk to you a little bit about what to expect here at the practice, etc., and get a general overview of what are the things you like and dislike, so that way I kind of have an idea before you even walk into the door. Then once that happens, usually you will have a medical assistant who's going to take some photos of you. And then all behind the scenes, before I actually come in to see you, what I'm doing is I'm working off of a little worksheet that I've generated. And this is something that I learned from Dr. Nassif and Dr. Pang over in LA. But basically, I go over what I see on your photos. What are things that, are some physical exam findings that might be pertinent or interesting to me. I also write down what are the things that I heard from the patient care coordinator that you like or dislike. Then we come in together, we'll sit, we'll talk, I'll finish out my exam sheet because there's usually some things that I have to physically touch and feel for, especially looking inside the nose. And then I also love, and I always ask for, if you guys have any examples of pictures that you like, pictures that you don't like, if you've done any modifications yourself to your nose on any pictures, those are really helpful for me because sometimes you guys don't know exactly how to enunciate what you're looking for, but I can look at what you have and what you want and figure out what's the difference. Sometimes as well, if you just really don't know, sometimes I have to ask a lot of leading questions like, oh, well, what do you think about this? And what do you think about this? And I really try my best to kind of estimate beforehand in this conversation what you like. After that, we pause, and then I will run into my office and start doing the Vectra 3D imaging. So that's the software that we happen to use here. And it's not perfect, but it's really good because it can, it is 3D, so we can kind of spin you around and show you in a bunch of different angles what you might expect. And it says this on all of the software printouts, but it's not a guaranteed surgical result, but it is a tool that we use so that way we can have a discussion. So especially for the patients who aren't entirely sure what they want, I really like to use that because we work off of that and figure out together what are the things that you like and don't like. So, I might play with the angle and say, oh, if I lift the tip up here, is that too much, or are you still happy with that? Or that way we can figure out some of the little bit more nuances together. The last thing that I do on the front of my little rhinoplasty worksheet is I have this kind of empty diagram that I will start filling in things on based off of our conversation. So we'll just, we'll throw up an example somewhere here, but basically the way it's done is black is stuff that we're adding and red is stuff that we're removing. And so I will start writing things like, okay, definitely need to rasp down the bone here, or align up the symmetry here, or do certain techniques that I know are going to achieve certain results, like you might see something there that says LCO. LCO stands for lateral crural overlay. So I put that in there so I know that okay, future me, we're gonna do a lateral crural overlay at time of procedure. And so I write down all the notes there. I'll also write down specifics like, patient wants a straight dorsum, or I might write patient wants a subtle scoop starting at the middle vault, whatever it might be. But I jot down everything there in addition to your medical record chart that we write your notes on. And then finally, on the day of surgery, actually it's really kind of the day before surgery, usually I will review all of my notes that I've taken, so I have a game plan again of what we're planning to do. But then on the day of surgery, we make sure there's nothing that you want to change while you're still awake in the pre-op holding area. And then I will literally work off of my worksheet. And it's great because I would say it's probably about accurate 90% of the time. So I work off of that, and then sometimes there's a little bit of improvising based off of what we find. But we've been pretty successful at kind of delivering people what they want based off of that, and that's how I go about doing my rhinoplasty and nose jobs. So just giving you a little bit of insight of what happens behind the scenes. Hopefully that was exciting or interesting or something or other, at least for prospective patients. If you are kind of wondering what I'm doing when I'm scribbling on the paper next to you all the time in our consults, this is what I'm doing. I'm jotting down all the notes so that way we can have your plan. So that all being said, my name is Dr. Wang. I hope to see you someday in our office. This is our episode of Face the Facts on how I plan for rhinoplasty, and we will catch up next time next week.